right? Correct. All right, correct. So the right atrium would have what blood vessels going into it?
The posterior and inferior vena cava.
Posterior and inferior is the same thing.
Posterior and
Superior.
Yeah.
Superior and inferior, or anterior, posterior. So these are veins which are very thin-walled compared to arteries, which have to withstand a lot higher blood pressure. So here's the anterior vena cava going into this right atrium, and here's the posterior vena cava. So see, they're really just like little openings. And on most of yours, all that happened was that this was cut, and it ends up looking like one big joint hole. And for the left atrium, what blood vessels go into the left atrium?
Pulmonary
veins. Pulmonary veins. Is it high oxygen or low oxygen?
High oxygen.
Right, it's just come from the lungs. And there's a left and a right pulmonary vein, which would be these openings right here.
Oh my goodness, what's the third one?
This one is the posterior vena cava.
So they're really close to each other?
They are very close to each other, but you can tell where, this one clearly goes to that atrium, whereas these holes clearly go to this atrium.
And why is the atrium so far separate? Like, aren't there the overhanging lobes? What are those called?
Oracles.
The oracles.
How do you know that's an atrium and not an auricle?
The auricle, as I understand it, the auricle is just a region of the atrium.
I see.
It's just, so that there's a label. You can
For
be
the flap.
talking about the flappy part as opposed to this part.
Okay.
Okay. I was going to say the atrium's actually cool.
Yeah.
The atrium is the whole chamber. And unfortunately, all the diagrams and stuff, it's just a little misleading because they look like these big, beautiful chambers, and they're really just these like little pouches sitting on top of the big, important ventricles. And since you guys are all here, this blood vessel, this is coming out of the right ventricle, right? There's my finger in the right ventricle. So what's this blood vessel?
Pulmonary trunk.
Pulmonary trunk, which would branch into the left and right pulmonary arteries. And then this one is the aorta, coming from the left ventricle. Okay. And
You really got to stick your fingers in there to figure out where things are going. That's good.
yeah, and this is your chance to do this because, on a test you can't test.
I just
be
throw the
touching
heart at you.
everything. I often test with a model because it's hard to see it on these things. And then when we get to the fetal heart, you'll be able to practice all this again. Cool. It's going to be this big.
Do the left and right pulmonary arteries go to the carotid?
To the what?
Up to the carotid artery?
No,
Or-
where would pulmonary arteries go?
Oh, to the lungs.
To the lungs.
What leads from the carotid arteries then?
Well, the aorta comes up, and there's an arch going to the left, and in people, which is what that model is back there, there's 3 branches off of it, and one of that will go up to the carotid arteries. You guys will learn that whole pathway in the pigs, though, and they only have 2 branches, and one comes up and divides into the carotid arteries and goes off to the right arm, or right leg, front leg, and the second branch goes off to the left front leg.
Where's the coronary sinus? Like the third circuit.
Okay. Anybody know where the coronary sinus
I know
empties
where it's
into?
supposed to be, but isn't it like from the bottom to the back?
It should dump into the right atrium, just like all the other blood from the systemic circuit, because really that's part of the systemic circuit. So the coronary circuit is the one that supplies the heart itself. So the high oxygen blood comes from the left ventricle. It's going out the aorta, and basically immediately there's a blood vessel that branches off and comes and wraps around. And you can see evidence of where these blood vessels are. And on the model back there, you can see all the red ones are carrying oxygenated blood, and the blue ones are carrying the deoxygenated.